In this video, we present the results of double-blind clinical trials in humans using LPS-containing foods as evidence for the use of LPS as a food ingredient. In addition, if you have not accessed LPS Learning 2 yet, which describes the results of the basic study in animals, please also watch the video. So far, 5 double-blind clinical trials in humans using LPS-containing foods have been conducted, and all of them have been published in papers. Now, we will provide each summary. This is a study in individuals with metabolic syndrome. 41 individuals with prediabetes or prehyperlipidemia had consumed 400 micrograms of LPS per day for 2 months. The results showed a statistically significant difference in the reduction of hemoglobin A1c and LDL levels in the prediabetic group. No adverse events were observed. This is a study in individuals with osteoporosis. 48 women aged 40 or older had consumed 600 micrograms of LPS per day for 3 months. The subjects were followed up for 2 more months after completion of the study. The results demonstrated that, in a stratified analysis of premenopausal women, reduced bone density was observed in the placebo group, while not observed in the LPS group. No adverse events were observed. The purpose of this study was to improve bloodstream. 52 healthy volunteers had consumed 500 micrograms of LPS per day for 3 months. The results revealed a significant increase in fingertip capillary count in the LPS group at month 3 compared to the placebo group. No adverse events were observed. This study was conducted for preliminary tests of the immune system. 30 healthy volunteers had consumed 500 micrograms of LPS per day for 2 months. As part of the preliminary tests, various physical symptoms were examined. Among these physical symptoms, allergic symptoms in the eyes and nose during the study period were assessed in individuals with eye-nose allergy. The results demonstrated that the severity of symptoms was milder in the LPS group compared to the placebo group. In the graph on the right, shaded bars represent the placebo group, and black bars represent the LPS group. The scores for runny nose, plugged nose, sneezing, and itchy eyes, as well as the overall score of those symptoms, were all lower in the LPS group compared to the placebo group. Statistically significant differences were found in the score for itchy eyes and the overall score. No adverse events were observed in this study either. This study was conducted in individuals with eye-nose allergy, based on the results of the previously mentioned preliminary tests. 63 individuals with mild allergic symptoms had consumed 500 micrograms of LPS per day for 2 months. The study was conducted from January to April, including the pollen dispersal period. As shown in the graph on the right, the peak for cedar pollen dispersion is early March, while that for cypress pollen dispersion is late March. The results of the study showed that the use of anti-allergic medications was lower in the LPS group than that in the placebo group. No adverse events were observed. The data will be shown in the next slide. In this study, as shown in graph A, there was no significant difference in visible allergic symptoms between the LPS group and placebo group at weeks 4 and 8. However, the number of days on anti-allergic medications is significantly fewer in the LPS group, as shown in graph B. Graph C shows the results of anti-allergic drug calculated based on the strength of the drugs. The score was significantly lower in the LPS group. Graph D shows the corrected nasal allergy score, calculated by adding the anti-allergic drug score in graph C to the symptom score in graph A. The resulting score was significantly lower in the LPS group. These results suggest that LPS has an inhibitory effect against nose allergy. This table summarizes the results of the human trials we presented in this video. LPS has been shown to have a preventive effect on metabolic syndrome, reduce bone density, increase in capillaries, and prevention of nose allergy. Thank you for watching to the end of this video. For information on the results of the basic study in animals and dermatological effects of LPS, please also watch the separate videos.